Good afternoon. I know we're between you and lunch, but this is a very, very special moment, so thank you for hanging in there with us today. Today I have the great honor not only of presenting an award to a true humanitarian who has made remarkable contributions to the kidney cancer field, but also to celebrate a very dear and wonderful friend. I'm already going to get teary-eyed. It is my privilege to introduce Dr. Nazar Tannir, this year's Nicholas J. Vogelzang Humanitarian Award recipient. This auspicious award was named in honor of our late co-founder, board member, and gentle giant in the field, Nick Vogelzang. He was the first recipient last year. While he was no longer with us at the time, we were so grateful that his family was able to come and accept the award on his behalf. The Vogelzang Award is not an annual award. We created this only to be given when it is sincerely deserved, and this year the selection committee was swift and unanimous in their decision that Dr. Tannir, and that's Athena, because Dr. Tannir was so worthy of this award. Nazar embodies so much of who Nick was. Both devoted their lives to advancing kidney cancer treatment and patient care. Both made a profound impact in the lives of their patients, and both gave freely of their time and talent to all that knew them. Nazar will share much more with you about his amazing journey, but I want to recognize how lucky we are to have Dr. Tannir in our circle. He followed a pretty unique path, spending time in the community setting before becoming the academic oncologist superhero we all know and love today. His successful career in private practice was focused solely on his love for patients. He then brought the same patient-centric energy, compassion, and dedication back to the world of academia and advocacy. Dr. Tannir's leadership in kidney cancer is nothing short of extraordinary, and it's hard to imagine what the kidney cancer landscape would be without him. His contributions to phase 3 trials have led to FDA approval of several therapeutic RCC agents, transforming the landscape of kidney cancer treatment. He is an international recognized expert in variant histology RCC, including rare kidney cancer tumors like RMC and translocation RCC. He founded the RMC Alliance, demonstrating his commitment to accelerating target discovery and developing novel therapeutics for these challenging orphan cancers. But even while accomplishing all he has clinically, he's always made mentoring others a huge priority in his practice. One of many firsthand examples of this is when he approached Chris Wood and I a couple years ago, just for the mere possibility of asking, would it be possible for him to go emeritus status on our medical steering committee so he could make room for one of his own mentees? His dedication to this community and passion for others is beyond compare. I would believe nearly all of us in this room have been impacted by Dr. Tannir in some way. One of Dr. Tannir's mentees, our beloved Pavlos Masul, said it best when he said, Nazar Tannir is a mentor's mentor whose compassion heals, research innovates, and teachings inspire the future of patient care. It's hard to think of anyone more deserving of the Nicholas Vogelzang Humanitarian Award, and I couldn't agree more. If you were to ask me personally to describe Nazar, I would describe a kind man with an unwavering willingness to help anyone at any time, but not in a self-serving way. No matter where in the world he may be that day, he never hesitates to reach across departments or institutions to make sure you're cared for, personally and completely, and will follow up. Personally, I will forever be grateful for the kindness he showed my mother and me last year when she was diagnosed with lung cancer. He was the very first person to come visit us when she was admitted into MD Anderson and sat with us until, in just an attempt to provide comfort and support. His reach is far beyond the call of duty. Nazar, you truly embody Dr. Vogelzang's legacy. We honor you today, not just for your professional accomplishments, but for your profound humanitarian spirit. You have deeply affected my life. You've touched the lives of your patients and inspired countless others, many of whom are here today. Congratulations on this well-deserved recognition, and thank you for making the world a better place. We are all better for knowing you. Please join me in congratulating Dr. Nazar Tannir. recipient of the Vogelzang Award.
Amazing speech. Wow, I'm really overwhelmed, and I hope I can hold up. Gretchen, thank you for the bottom of my heart for your kind words and this warmest introduction. I know many other people, some of them are here in the room, really also would have deserved this award. I prepared few, but I don't know if I'll be as eloquent as you did, Gretchen. And I have few slides to share here with you. It's been really an honor for me to be part of the KCA. It's really my professional family outside MD Anderson. I'm humbled to receive the Humanitarian Award that carries Dr. Vogelzang's name because of what Nick really represented to many of us who knew him and to many whose lives he has touched. Nick epitomized what a physician in our noble profession ought to be. Early on in his life, he learned the meaning of calling and service from his father, who found his calling at the pulpit as a preacher, and from his mother, who found her calling in the classroom as a teacher. Nick realized his calling as a physician, a healer, a mentor, a researcher, and a leader. I got to know Nick after I joined the faculty at MD Anderson more than 20 years ago. We shared few patients together that he had referred to me because he knew of my interest in studying rare kidney tumors and caring for these patients with now what we call variant histology RCC. He invited me to speak to his group in Las Vegas, and there I got to see him in full action and saw firsthand his humility and kind leadership in his interactions with his colleagues. Nick and I collaborated on many clinical trials and participated in many conferences and advisory board meetings. I always admired Nick for his fierce advocacy for his patients, his wisdom and broad knowledge in oncology, his sponsorship of his fellows and faculty, and above all, his humanity. Nick was a towering figure and a humanitarian in chief. He had a big heart, and I want to show a big smile on his face. That's when he was the most comfortable with his patients, staff, and trainees. Many of us in the field of oncology have aspired to emulate Nick and follow in his footsteps. Now, I would like to share with you the stories of two young patients and two remarkable women behind these two patients that have shaped my own career. It was April 2012. I was in Munich, Germany, attending a kidney cancer meeting, and I received an email from Herman Connor and his sister Cora in South Carolina that he was diagnosed with RMC, but I sensed in their email that he was distressed. I sensed a desperation. Herman was in his 20s when he was diagnosed with RMC in 2012, but did not have health insurance. And because of that, and because of indifferent attitudes and unfortunately lack of knowledge by some of the providers he had sought in South Carolina, he felt trapped. I emailed Herman and Cora back that weekend and gave them a clinic appointment the following week. I knew I would have to go up to battle with the highest leadership at MD Anderson to get permission to treat Herman, but I was not willing to get a no for answer. So we treated Herman at MD Anderson, who had a primary tumor in his right kidney and metastasis to the lungs and lymph nodes. And at the time, we started chemotherapy with paclitaxel and carboplatin. He was already losing ground with fever, cough, shortness of breath, weight loss, and pain, and gross hematuria. But after 5 cycles of chemotherapy, he felt better, and scans showed complete response in the metastatic site. So I felt encouraged to send him to my colleague, Dr. Jose Karam, to perform a right nephrectomy. I was surprised when I received a call from the pathologist that he couldn't find a tumor, a gross residual tumor in the right kidney. I said, look some more, and he found a small focus of residual tumor in the right kidney. But unfortunately, after nephrectomy, few weeks later, Herman had recurrence of his RMC, and through weeks of follow-up therapies with pazopanib and other cytotoxic regimens, he had progressive disease again and did not respond. So I had to go back to what worked for him initially and treat him like leukemia and continued therapy with paclitaxel and carboplatin for 18 months to eradicate every clone of his RMC. So today, Herman turned 38 years old yesterday. 11 plus years. After he was diagnosed with RMC. And here is his picture with Cora, his sister, now looking full of health, and a productive member in society. But the other story I want to share with you is a heartbreaking one. It is the story of Chris Johnson, who was 39 years old when he passed away, 15 months after being diagnosed with RMC in September 2012. Towards the last few days of his life, I visited him in the hospital room to tell him that we were running out of options. And Chris' words to me are forever etched in my conscience and ring loud today to remind us of the urgency of our work and our research. What do you mean you have no more treatments to offer me? Chris said. I have a 6-year-old daughter. And I would like to see her graduate from high school. You are MD Anderson. As I left Chris's hospital room, I felt the agony of defeat. Chris passed away peacefully, surrounded by his loving mother, Richie, who is here, and his loving family. He would have turned 51 on the 18th of this month. But his legacy will live on because of what he told me and the challenge he gave me to do better. And I felt if it's not now, when? And if it's not us, who will do it? So we embarked on an RMC research program. Gabrielle is now a senior in high school and will walk on stage in May 2024 to receive her high school diploma. And her father, Chris, will be there for her in spirit to cheer her and is proud of her as she is choosing a career in healthcare. Richie retired from nursing to focus on RMC. She founded the Chris Johnson Foundation in honor of her son. And for the past 10 plus years, Richie's organization has grown into a powerful movement to raise awareness of RMC, increase research funding, and advocate at the local, state, and national level to enact legislation to help patients with RMC. And at the personal level, Richie has offered her warm heart to support patients with RMC and their caregivers. People from all over the states reach out to her for guidance and support. She turned her pain and anguish after losing Chris to help others in need. While Chris had a private health insurance, which supposedly should have covered his treatments, Richie was faced with dealing with insurance, bureaucracy, denials, and injections and rejections. In her book, I Am Tired, A Mother's Journey Through Her Son's Cancer Battle with RMC, she talks about the frustration of having to fight with insurance carriers while fighting for her son's life. No one should have to go through the ordeals that Herman and his sister Cora, that Chris and his mom, Richie, had to go through when facing a catastrophic illness like cancer. From this forum, we should all advocate for universal health care, because health care is a right, not a privilege. Since 2012, we made initial observations that provided a clinical framework for questions on what we should do in RMC as research. So we established that sunitinib and the class of agents we call VEGF-RTKI are not effective in RCC, in RMC like they are in RCC, in clear cell RCC. And then we know now the reason, hypoxia is a real hypoxia in RMC, whereas it is pseudohypoxia in clear cell RCC. We established that upfront nephrectomy is harmful to patients with RMC, even if they did not have metastatic disease, because they have recurrence so quickly after surgery, and because RMC is a disseminated disease at initial diagnosis. We also made the observation that immune checkpoint inhibitors are not effective, but they actually cause acceleration and hyperprogression of RMC. And we did 2 clinical trials, one with pembrolizumab, and all 5 patients that I enrolled on that trial had rapidly progressive disease, and we published this year. And we finished a clinical trial. We said, well, maybe nivo-ipi will be better than pembrolizumab. So we enrolled a trial. We enrolled 10 patients on that RMC trial with nivolumab and ipilimumab, and all 10 of them had rapidly progressive disease. But we really needed to understand why. And I think, it takes a scientist, a brilliant, a genius like Pavlos to really, with his colleagues that I recruited to the department, physician scientist Giannicola Genovese and Jianjun Gao and others, to really unravel, decipher this mystery. And, I'm sure Pavlos will speak about this, but he got an R01 to study the hyperprogression in RMC, and he scored 6th percentile. So that's, for an investigator, only 5 years after fellowship. So I'm proud to have recruited him and others to the cause. We also made observation that many of our patients who were coming to see us had been in the military, active in the military, and many were athletes. And so it was really a conundrum why, we're seeing these patients who are, robust and muscular. And again, Pavlos and the team were able to really shed light on this intense exercise and how it could be a modifiable risk for RMC, other than, of course, the established one, that's sickle cell trait. But very importantly, and again, this is a message for rare kidney tumors, and rare tumors in general, rare diseases in general. People think, well, if you have a clinical trial, how are you going to enroll? You're not going to really finish a trial. And, in 2015, I opened a trial with an EZH2 inhibitor, tazemetostat. And as they say, when you build it, they'll come. And in 6 months, I enrolled 9 patients. In 6 months. They came from all over the States, and unfortunately, the trial was negative. Also, although initially we've seen some dramatic responses and patients improved so quickly, but unfortunately, the response was not durable. And that reminded me of Lorenzo's oil movie, where you get excited. Zita and I in clinic were doing high fives when we saw some scans initially, only to be really sobered that the disease came back with vengeance. But there is hope that all these negative trials are leading us to understand more about these rare tumors and RMC in particular. And I know the future lies in research. So I think come forward to 2015, I was building up the team, collecting all the tissue, the cell lines, the PDXs, bringing Giannicola Genovese, Cheryl Walter from MD, from Baylor College of Medicine, to really have a team of scientists to advance the field. And walked in my clinic in July 2015, this young man from Greece, an MD, PhD, and he said, I'm in your clinic. I'm going to spend my fellowship with you. The chief fellow and the fellowship leadership said to come to you, work with you in GU. I'm interested in GU. I said, what are you interested in, and what have you done before? I said, I was at the Mayo. I studied oncolytic viruses in prostate cancer. I said, well, look, we have a bigger problem. We have RMC, and we need this is a killer and a formidable foe, and we need all the help we need. So, some of us talk about RMC pre-Pavlos and post-Pavlos, and I think this is really how it went, and I think he'll talk about his journey in RMC from the scientific standpoint and what we've been able to accomplish. But I really think those advances would not have come if it weren't for two principles that guided me in my career over 42 years in oncology. The first one was Dr. Emil J. Freireich. When I was a fellow back at MD Anderson back in the early 80s, he told us, if you want success, surround yourself with smarter people than you are and be humble about it. Don't have an ego. I took this to heart, this advice. But I also added my own, and which is, when you have fellows who are bright and smart, give them wings and they'll fly. And I think this has served me well. I want to end in closing with, you can't have a humanitarian award without talking about humanity and spirituality and give hope to the people who are going through this, and I know some of them are in this room. And, it's a prayer that I've had on my wall in my office, on the wall of my office for years at MD Anderson. It's Moses Maimonides' prayer. And that's Maimonides' words. Inspire me. Inspire me with great love for my art and for thy creatures. Let not the thirst for gain or the ambition of renown and admiration spoil my work, for they are enemies of truth and love of humanity, and may divert me from the noble duty of caring for the welfare of thy creatures. Give strength to my body and spirit, that they may always be ready to help in good cheer the poor and the rich, the bad and the good, the enemy as well as the friend. Grant me that in the suffering I see a human being. Thank you very much. Thank you. Thank you. Thank you very much. Thank you all for staying here. Appreciate you. And I want to end with saying hope with capital letters, H-O-P-E. Please have hope. And RMC and all the rare kidney tumors and RCC and cancer, we see you, we will defeat you, and we'll make you history.